In this video, you'll learn the most important facts every senior and older adult needs to know about measles as it affects people aged 60 and above. We'll walk through the symptoms you need to watch for, the real risks measles can pose for older adults, and practical steps you can take today to stay protected. Whether you're living alone or managing your health with the help of others, this video is here to guide, support, and empower you. 1. Why older adults are still at risk. Measles isn't just a childhood illness. It's easy to assume that once you've reached a certain age, you're in the clear. But the truth is, older adults can still get measles, and the risks can be more serious than many realize. As we age, our immune systems naturally become weaker. This means your body doesn't respond to infections the way it used to. What might be a mild illness in someone younger can lead to more severe complications in an older adult. Here's another reason to stay alert. Many adults over the age of 55 were never fully vaccinated against measles, either because the vaccine wasn't available when they were younger or because they didn't receive the recommended 2 doses. And even if you were vaccinated decades ago, your immunity might have faded over time. This doesn't mean you need to be afraid. It means you need to be informed. Being aware of the risks and knowing how to protect yourself puts you back in control. That's the purpose of this video, not to alarm you, but to empower you. So if you're wondering, could this still affect me? The answer is yes, but it doesn't have to. You have the power to take action. Before we move on to the next symptoms, make sure to subscribe to our channel. By subscribing, you'll get more helpful tips and easy-to-follow advice on how to live and enjoy a peaceful, happy, and healthy life. Don't miss out, hit that subscribe button now. 2. The first symptoms. What to watch for. Talking about the symptoms, measles often shows up quietly, and by the time the obvious signs appear, it's already spreading. Most people expect to see the rash first, but that's not how measles begins. In fact, the early symptoms feel just like a cold. A rising fever, a dry cough, a sore throat. You might also feel unusually tired or achy. Then come the red, watery eyes and a runny nose that won't seem to stop. These early signs are easy to overlook, especially if you're used to brushing off mild illness. But with measles, every day matters. The rash, the one most people associate with measles, usually appears several days after these first symptoms. It starts at the head and spreads downward, covering the body. But by the time the rash shows up, your body has already been fighting the infection, and the virus may have spread to others. That's why early awareness is so important. If you notice any of these signs and you're unsure of your vaccination history, don't wait. Call your doctor. Let them know what's going on. Measles can move quickly, but so can you. Taking action early can prevent complications, reduce the risk of spreading it, and give you peace of mind. This is your health, and it deserves your full attention. 3. Understanding the measles rash. Rashes is the most visible sign of measles, and often the one people wait to see before taking measles seriously. But here's the truth. By the time the rash appears, the virus has already been active in your body for days. That's why it's so important to understand what the rash looks like, where it shows up, and how to recognize it early. The measles rash usually begins at the hairline right at the top of the forehead or scalp, and then slowly spreads downward. It moves from the face to the neck, then across the chest, back, arms, and eventually to the legs and feet. It doesn't come and go like some allergic reactions. It spreads in a pattern and stays. At first, the rash looks like flat red spots, small, round, and close together. As it progresses, the spots may start to join together, forming larger patches. Some people describe the skin as looking blotchy or flushed. In some cases, you may notice small raised bumps mixed in. Now, as someone older, you may already have sensitive skin or deal with occasional rashes, maybe from medications, dry skin, or other conditions. So how do you tell this rash apart from the usual? What makes the measles rash different is that it comes with the other symptoms we talked about earlier: fever, cough, runny nose, and tiredness. It usually appears about 3 to 5 days after those first symptoms start. So if you're feeling unwell and you suddenly notice a rash that's spreading, don't wait it out or hope it goes away on its own. This is especially true if you've had contact with someone who's been ill recently, maybe a grandchild, a visitor, or someone at a public event. Measles spreads before people even know they're sick. So if you notice a rash that's following this pattern, paired with other symptoms, call your doctor right away. And I want to say this clearly. There's no shame in being cautious. You deserve to take your health seriously. Even if it turns out to be something else, you'll have peace of mind, and that's worth everything. 4. Complications older adults face. This is a little more serious, the possible complications of measles in older adults. This isn't to scare you, it's to prepare you because when you understand what could happen, you're far more likely to respond early and protect yourself from the worst. Measles is not just a rash and a fever. It can lead to life-threatening complications, especially in people over 60. One of the most common and dangerous is pneumonia. This is when the lungs become inflamed and filled with fluid, making it hard to breathe. In older adults, pneumonia from measles can develop quickly and become severe. And if you already have lung issues or a weakened immune system, your risk goes up even more. Another rare but serious complication is encephalitis, swelling of the brain. This can lead to confusion, seizures, or in extreme cases, long-term brain damage. Again, it's rare, but older adults are more vulnerable. Then there's the fact that measles can make existing health conditions worse. If you have diabetes, high blood pressure, heart problems, or any chronic condition, your body is already working hard to stay balanced. A measles infection throws off that balance. It can cause spikes in blood sugar, stress your heart, and weaken your ability to recover. But here's the good news. You are not powerless. When measles is caught early and treated properly, most people recover fully. The key is awareness. Don't ignore symptoms. Don't push through feeling unwell. And don't hesitate to ask your doctor questions even if you think you're bothering them. You're not. That's what they're there for. The sooner you take action, the lower your risk of complications. You have the strength to protect yourself. And every day you stay informed, you're taking back control over your health. 5. How measles spreads and how to avoid it. Measles is one of the most contagious viruses we know of. It's airborne, which means it doesn't need close contact to spread. When someone with measles coughs or sneezes, the virus goes into the air and it can stay there for up to 2 hours. Yes, even after they've left the room. You could walk into a waiting room, a grocery store, a church service, and if someone with measles was there before you, you could breathe it in without even realizing it. That's why measles spread so fast, especially in public places. It's not about panic. It's about being prepared. So what can you do? First, know the signs of outbreaks in your area. Your local health department or doctor's office can tell you if cases are rising nearby. If there is an outbreak, it's a good time to limit time in crowded spaces, especially places like hospitals, airports, or places where children gather. Second, remember that not everyone around you is protected. You might be cautious, but not everyone is. Some people may not be vaccinated, or they may not even know they're sick yet. That's why it's so important to put your own protection first. Here are a few simple habits that make a real difference. Wash your hands often, especially before touching your face or eating. Avoid close contact with anyone showing cold or flu-like symptoms. Keep hand sanitizer with you when you're out. And if you're ever unsure, keep some distance. It's okay to step back politely. Your health comes first. Also, if you have grandkids or spend time with young children, make sure their vaccines are up to date too. It helps keep everyone safe, including you. Clean habits and thoughtful spacing can seem small, but they matter more than most people realize. You're not helpless against measles, far from it. Every small step adds up to a stronger line of defense. 6. What if you had measles as a child? Are you still safe? Now, you might be wondering, well, I had measles when I was a kid. Doesn't that mean I'm protected for life? The answer is, maybe. But don't rely on guesswork when it comes to your health. It's true that most people who had measles as children develop natural immunity, but not everyone remembers their full medical history, and some people may have had a mild illness that wasn't actually measles. Plus, if you only had one vaccine dose instead of the recommended 2, your immunity might not be as strong as it should be. And even if you did have the full series, either through infection or vaccination, it's possible for immunity to fade over time. That's especially true as we age. The good news is that you don't have to wonder. A simple blood test can check your immunity level. Your doctor can order it, and it only takes a few minutes. That way, you'll know for sure, and you can take the next step confidently. So don't assume. Verify. This is your body, your life, and your future. You deserve to have real answers. And if your immunity is low, your doctor may recommend a booster shot, something that's safe and effective, even in older adults. The goal here is peace of mind. You've taken care of others for years now, it's time to take care of you. 7. The role of vaccination in older adults. One of the biggest questions people ask is it too late to get vaccinated? And the answer is simple. No, it's not too late. If you were never vaccinated as a child, or if you're unsure about your immunity, you may still benefit from getting the MMR vaccine as an adult. Yes, even in your 60s, 70s, or beyond, because measles doesn't care how old you are, and your protection matters now more than ever. The Centers for Disease Control and many health experts agree if you don't have evidence of immunity, it's worth talking to your doctor. So who should bring this up with their provider? You should if you were born after 1957 and never had a documented MMR shot. You don't remember if you had measles or were vaccinated. You spend time around children or travel, especially internationally. Or if you just want peace of mind knowing you've done everything to stay protected. Now, I know some of you may be thinking, what about side effects? Is it safe at my age? And that's a smart question. It shows you're thinking about your health in the right way. The MMR vaccine is considered safe for most healthy adults. Your doctor will always consider your personal health conditions, like whether you're on certain medications or have a suppressed immune system before making a recommendation. But if you're generally well, the vaccine is a safe, effective way to protect yourself. You may feel a bit sore at the injection site or have a mild fever or fatigue for a day or two. But these effects are temporary and far less serious than the potential consequences of measles. Choosing to vaccinate isn't a sign of fear. It's a sign of wisdom. It means you're taking control of your health. It means you're looking out for those around you, too. And most of all, it means you value yourself enough to take preventive action, and that is something to be proud of. 8. Caring for yourself if you get sick. Despite your best efforts, it's still possible to catch measles, especially during an outbreak. So let's be ready. Let's talk about how to care for yourself if that day comes. First, if you notice early symptoms, fever, cough, sore throat, and then the rash, call your doctor immediately. Let them know your symptoms and follow their guidance. If you're advised to stay home and manage symptoms, here's what that looks like. Rest. Your body needs energy to fight the virus. Don't push through. Slow down. Give yourself permission to fully rest. Hydration is essential. Sip water, herbal teas, or electrolyte drinks regularly, even if you don't feel thirsty. Measles can dehydrate you quickly. Control the fever. Your doctor may recommend acetaminophen or another fever reducer to help you stay comfortable. Don't guess, always follow medical advice. Next, monitor your symptoms carefully. If you feel short of breath, become confused, develop chest pain, or your fever climbs very high, seek medical help immediately. These may be signs of complications, and early treatment can make all the difference. And here's something important. Don't isolate silently. Yes, you need to stay away from others to prevent spreading the virus, but that doesn't mean you have to go through it alone. Let someone you trust know what's going on. Ask a family member or neighbor to check in on you. Stay in touch with your doctor. Even a phone call can help you feel less alone. You've faced hard things before. You've gotten through tough times. And if measles hits, you have the strength and the support to get through this. 9. Protecting others in your life. If you have grandkids, a caregiver who visits regularly, or friends who drop by, then you already know how much your choices matter. Measles is highly contagious. Even before you show symptoms, you can unknowingly spread it to someone else. That's why staying informed and proactive isn't just about you, it's about everyone you love. So, how do you keep your home and your circle as safe as possible? First, if you're feeling under the weather, hold off on visits. It may feel inconvenient or even disappointing, but those few days of rest can make all the difference in stopping the spread. Second, create a space at home that's clean and mindful. That means washing your hands often, disinfecting surfaces like doorknobs, phones, and remote controls, encouraging visitors to stay home if they're unwell. This isn't being overly cautious, it's being wise and kind. And here's something else you can do. Start the conversation about vaccination. Gently ask your grandkids' parents if they're up to date. Remind your adult children that immunity can fade. And let your caregiver or nurse know that you care about health on both sides. No pressure, no judgment. Just shared responsibility because health is a group effort. When you take care of your own health, you're setting an example. And when you encourage others to do the same, you're helping build a circle of protection that reaches far beyond your own front door. 10. Your personal action plan to stay protected. You've listened, you've learned, And now it's time to take a few simple but powerful steps forward. Step 1. Get your immunity checked, whether through a blood test or a conversation with your doctor. Find out where you stand. Don't assume you're covered, get the facts. Knowledge gives you power. Step 2. Review your vaccination history. Pull out those old records. If you don't have them, your doctor can help you figure it out. They may recommend a booster shot or at least confirm whether one is needed. Step 3. Strengthen your everyday habits. Eating well, getting rest, staying active in small ways, and managing stress all support your immune system. Even a short walk or a glass of water can be a step in the right direction. And here's the most important part. Remember that you're not helpless. You are not stuck. You are not forgotten. You are the one in charge of your health. Each small action, checking your status, making a call, staying mindful, adds up to something powerful, something life-changing. You've gotten this far. You can take it from here. You've taken a powerful step just by watching this video. You didn't look away. You didn't ignore the risks. You showed up for your health, and that means something. Your age doesn't make you weak. Your experience makes you wise. And your health is worth protecting today, tomorrow, and every day that follows. So if this video helped you, please consider sharing it with someone else. Maybe a neighbor, maybe a friend, maybe another senior who hasn't heard this message yet. You could be the reason someone gets the protection they need. And if you want more honest, empowering health videos made for people just like you, subscribe. We're here to support you, inform you, and walk with you through the journey of aging, with strength, with dignity, and with hope. Until next time, stay aware, stay proactive, and take care of yourself. You matter.